Hi, my name is Erika Crawford. In 2010, I became very ill. It started with persistent headaches, nausea, and bruising on my lower legs. I had multiple admissions to the hospital and seen countless amount of doctors. My symptoms started to progress, and I started to lose a lot of weight, and my body started to deteriorate. Doctors could not figure out what was wrong with me, so automatically assumed it was in my head. This is a really hard time for me, not only physically but emotionally. Could you imagine someone telling you your symptoms are all in your head just because of lack of expertise with my disease? School-wise, I was homeschooled for most of high school, so I lost most of my teenage years while being ill. In 2012, I started to get severe joint, bone, and muscle pain all over my body and dislocations. Later in the year, I started to go blind in my left eye. All of my symptoms got worse and had new symptoms such as blackouts, speech problems, as well as my whole left side became very weak. As time went by, I became very depressed and couldn't handle it anymore, so I admitted myself into the mental ward because of all the doctors constantly telling me it was all in my head and I was doing it for attention. They could not figure out my case, so they said it must be a mental issue. I was at my lowest low in my life, and I was extremely depressed because of this. At that point in time, the psychiatrist got genetics in right away to prove that I had no mental issues and that it was physical. The genetics doctor discovered it was not in my head and that I had a rare connective tissue disease called Ehlers-Danlos syndrome, and that there's no treatment or cure for it in Canada. We then sought out the ILC Foundation, which directed us to Dr. Henderson and Dr. Frank Mano. We went down to the States to visit these two doctors. They both diagnosed me with cranial spinal instability and as well as a pinched artery, which was causing the blackouts, loss of vision, and my weakness in my left side. Dr. Henderson said that I needed the surgery as soon as possible, and it was booked for the following month. After the operation, I got my vision back, the blackouts went away, and I was able to walk again. I have to admit it wasn't easy, but I had the support of a wonderful doctor, family, the ILC Foundation, friends, and all the kind people who donated to save my life. Shortly after the surgery, I found out that I have a rare blood condition called S1 protein deficiency. I am now on my 21st treatment, and I am booked in for a year every week for infusions. Currently, I am attending Mohawk College and taking biotechnology and wishing to go into the research field one day so I can research on EDS and one day find a cure. Thank you for your time.